My name is Anna Navarro, and this is my Nursing 612 Heart and Respiratory video, chest video. This is David. He will be my patient today. First, I will be assessing his chest. As he's facing forward, I will be assessing his anterior chest. Primarily, right now, I'm assessing his respiratory effort. I'm looking at his lips. His color of his lips are pink. There's no pierced respiratory effort. I'm looking at his nail beds. They're nice and pink. There's no clubbing noted. Also, I'm looking at his respiratory effort. He's breathing without any respiratory distress. His chest his rhythm is evenly distributed. There is no abnormal respiratory effort. As I'm looking at his the symmetry of his chest, the expansion of his chest is symmetry. The AP, anterior, posterior diameter is ordinary, is less than the transverse diameter, and is symmetry. It looks like he's breathing about 16 respiratory breaths per minute. Also, I am going to start assessing his the apical pulse. As I'm going to go down and feel for his apical pulse, I can palpate it down his down the PMI. As I'm palpating his pulse, I am going to take my other hand and palpate the carotid artery and make sure that they're simultaneously palpated at the same time, and they are. It's in rather regular rhythm, and they are. Also, I'm going to start percussing his chest and start feeling for the outline of his heart. Normally that is checked by a chest x-ray. Since we don't have that here in my home, I'm going to percuss that. So David, just stay there. As I'm percussing it, I do feel that as I'm going down, I feel the outline of his heart while I'm percussing, and as I'm percussing, I hear the dullness and the transients of in the outer portion of his heart. Okay. Also, I am going to start feeling I'm going to start listening actually for his heart, the sounds of his heart. The first sound I'm going to be listening for is the aortic valve area, and it is regular. The second heart sound, I'm going to listen to the pulmonic valve area, which is nice and regular. I'm going to listen to the herbs area. Next, I'm going to listen to the tricuspid area. And then now I'm going to listen to the mitral or the apical area, which is nice and regular. And I'm using it with the diaphragm of my stethoscope. Now, if I wanted to listen to these heart tones are S1 and S2. Heart sounds I could hear is a nice lub-dub sound. If I wanted to listen to the S3, I would have him go in a left lateral position, and I would listen to a murmur with the bell of my stethoscope. Okay. The next thing I want to do while he's in the anterior, I want to also listen for, actually we are going to listen for, palpate for the, we can't cut to vocal resonance. So what I'm going to do is I'm going to place my fingers here, my hands, and David, I'm going to have you repeat after me. Can you repeat 99?
99.
Again, 99.
99.
Okay, and again, 99.
99.
Okay, I can feel equally the vocal resonance, and I don't have, it's equal on both sides. Okay, very good. So right now, I'm going to have David go ahead and stay where he is, and then I can feel right here, I'm feeling for his trachea, which is nice and centered. I don't feel any deviation of his trachea. Also, his notch here is right, nice and centered along his clavicle area. So I don't feel any abnormal deviations right here. Okay? Okay, David, would you go ahead and turn around? I'm going to have you turn around. And right now, I'm going to also inspect the back of his back. Go ahead and breathe normal. And on his back, he has nice color. There's no cyanosis present. Go ahead and sit up straight. There is no abnormal accessory muscles being used. He is not having any problems, difficulty, no any respiratory distress. So I'm pretty confident that I can, go ahead and assess him and not, be worried that he's going to have any problems. Okay, also David, we're going to do basically the same thing that we did in your front chest, okay? All right, so what I'm going to do is I'm going to start measuring for diametric excursion. What I'm going to do is have you hold your breath deeply, David, and then I'm going to go down to feel down your scapula line, which is down here, okay? And then I'm going to have, as I'm doing that little thing, tapping with my hand, I'm going to actually listen to your, when you hold your breath, okay? So go ahead and hold your breath. Hold your breath in. Take a deep breath.
Yeah.
Take a deep breath in. Deep. Okay. And I'm going to tap down. Until I feel what changes to a dull resonance. Okay. And then I'm going to mark it with this tape here, so I know where to mark it. Okay. And then go ahead, start breathing. Okay, breathe normal. And then I'm going to do the same on this side. Go ahead, take a deep breath. Yeah. Okay. Okay, go ahead. And then I'm going to have you take a deep breath in and then go out, exhale it, and then hold it. Where I don't hear that anymore, the dullness, resonance, and I'm going to repeat that on the other side as well. Where I don't hear that dullness anymore. Okay, there you go. And then I have a tape measure, and we're going to measure that distance. And what we're looking for is between 3 to 5 centimeters. You're about 3 and 3.5. So what that tells me, that exclusion, your exclusion measure is fine. So we're good, okay? I'm going to take this off. Also, I'm going to just come down here, take a deep breath in, and I'm just going to feel your lungs and check your symmetry. Take a deep breath in your lungs and see. There you go. Your lungs are nice and symmetrical. Sorry, you're a little ticklish. Okay? It's nice and symmetrical. All right? Also, I'm going to listen to your heart sounds in the back. Take a deep breath in and out. In and out. In and out. In and out. In. Do it again. In. In and out. Okay, what I'm listing, I don't hear any wheezes, any crackles, any abnormal heart sound. Any lung sounds. They're nice and clear, and I'm going to listen also again for tactile fremitus. Go ahead and say 99.
99.
Okay, go ahead and say 99.
99.
Okay, again, 99.
99.
Okay, so there's even on both sides the tactile fremitus. So it's even on both sides. Go ahead and come around. We're gonna go to the anterior part of the to the front side because I didn't listen to your lungs on this side. I listened to your heart, but we didn't do the lungs. So that was the okay. Breathe in and out. In, out, in, out, in, out, in, out. Okay, and out. Okay, so what I'm listening to for David with his lung sounds in the anterior part of his lungs are clear. They are bronchiovascular sounds. They are moderate in pitch. The intensity is low, and that will conclude my video. Thank you so much.